Canada has adopted new guidance on low-risk alcohol consumption, drastically slashing the amount of booze considered safe in 2011. A report by the Canadian Centre on Substance Use and Addiction says the latest evidence shows that alcohol is a carcinogen associated with 7 types of cancer, mostly of the breast and colon, as well as heart and liver disease, dementia, and lower respiratory infections. Men are more likely to develop alcohol use disorders, drink excessively, be involved in vehicle crashes, and risk perpetrating violence. Joining us to discuss alcohol consumption and health is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome to Forum Daily.
Great to be here.
So firstly, what are the broad risks of overconsuming or overconsumption of alcohol?
Well, so binge drinking or drinking to excess really has a very broad list here. We've talked a little bit about unintentional injuries, violence, but heart disease, high blood pressure, inflammation of the gastrointestinal system, and also alcohol abuse disorder that can result from it. We also see many complications from acute impairment, secondarily violence there, road crashes, child abuse, and neglect. And we should mention as well that alcohol is a teratogen, which means it causes malformations of the fetus. So it can lead to learning, health and social effects, and long-term impacts when had during pregnancy as well. So quite a few effects of alcohol overuse.
And the new guidelines released this week. From your perspective as a doctor, how do you think these new the new alcohol guidance is going to affect or impact the health of Canadians, with the message, I think, effectively being less is better?
Right. So what we know during the pandemic, there were a lot of changes in alcohol consumption. In fact, 1 in 4 Canadians reported that they had increased their alcohol consumption during the pandemic. This was in fact highest in Ontario, where 30% of Ontarians increased their alcohol consumption. So the guidance is helpful because it really puts more knowledge to people about their alcohol use. And in turn, then Canadians can look at moderating their own consumption accordingly there.
Now, this report, going back to it again, the evidence shows that alcohol is a carcinogen. So what do we know about that?
Right. So in this case, what we've seen is that drinking alcohol does raise your risk of developing head and neck, breast, colorectal, esophageal, liver, stomach, and pancreatic cancers. We know that smoking and drinking together increases that risk, and it increases it far worse than if you did one or the other on its own. In terms of the actual risk, drinking about 3.5 drinks a day can double or even triple your risk of developing cancer of the mouth, pharynx, larynx, and esophagus, and can definitely increase colorectal cancer and breast cancer by about 1.5 times. So significant increases there.
Some concerning numbers there for sure. The report is also highlighting the impact of alcohol on dementia and lower respiratory infections. So can you unpack this a bit for our viewers?
Right. So respiratory infections, we're seeing data that the more you drink, the more your immune system can't fight off infections. So no surprise that we're seeing an increase in respiratory infections and even increased illnesses that we don't typically see, like tuberculosis from excessive drinking. The systematic reviews have also found that individuals who drank heavily or engaged in binge drinking were more likely to develop dementia or Alzheimer's disease rather than those who were engaged in more moderate or low alcohol consumption.
Again, also somewhat concerning information there as well. But shifting gears a bit from health to the social impacts of overconsumption, is that something that you see is as a practicing doctor? Do you deal with that sort of thing?
Right. I think we see it quite a bit. We see the increase of DUI-related accidents, traffic fatalities, public and private property damage. We also see a decline in terms of chronic health conditions, and we see the domestic violence as well as violent crime. So it certainly is very far-reaching, even from a societal point of view.
Let's not end on a negative note, but what sort of options or treatments are available, or an option for those who may suffer an addiction from alcohol or to alcohol?
Right. So if you are concerned about alcohol use, we do have a diversity of Canada-wide resources for you. Wellness Together Canada, Alcoholics Anonymous, CPHA, Moms Stop the Harm, and Families for Addiction and Recovery are some of the few ones that you could see on the Health Canada website.
Very helpful. And if you could leave our viewers with one message about alcohol consumption, what would it be?
So we're slowly coming to the main message that this guidance is saying, which is really even a small amount of alcohol is not good for your health. So the message I would leave my viewers is really the message of Cicero from 50 BC. Never go to excess, but let moderation be your guide.
You can never go wrong with a quote from Cicero. Thank you for that, Dr. Raut. We look forward to having you again on Forum Daily.
Thanks for having me.